Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson is an introduction to community nursing concepts such as surveillance and outbreak and investigation. By the end of this lesson, you should be able to define public health surveillance. You should be able to list types of surveillance systems. You should be able to identify steps in planning, analyzing, interviewing, and evaluating surveillance. And you should recognize sources of data used when investigating a disease or a condition in an outbreak and describe the role of an RN in surveillance and outbreak investigation to the national core competencies for public health nursing. What is disease surveillance? Disease surveillance has been a part of the public health protection since the 1200s. During the investigations of bubonic plague back then in Europe, surveillance provides a means for nurses to monitor disease trends in order to reduce morbidity and mortality and to improve health. Okay, surveillance is a critical function for nurses practicing in the community. So surveillance is important because it generates knowledge of a disease or event or outbreak pattern. It tells us a lot about what's going on with that disease. Surveillance focuses on the collection of process and outcome data. So you're looking at data. Although surveillance was devoted initially to monitoring and reducing the spread of infectious diseases, it is now used to monitor and reduce chronic diseases as well, and injuries as well, and environmental and occupational exposures. So the term surveillance in public health has grown a little bit to include these four things. Okay, so we're no longer just looking at monitoring and reducing a spread of an infection, we're also looking and monitoring and reducing the rates of chronic diseases. We're looking at injury rates and trying to decrease those. We're looking at environmental and occupational exposures and trying to reduce those. Okay, what is surveillance? Surveillance activities can be related to the core functions of public health. So I have included what is called an intervention wheel. The intervention wheel includes all the things that a public health nurse does. And you can see here, it's really hard to see, but that portion of it is surveillance. Surveillance can be a population-based surveillance. You can do a different system. You can look at the population, the systems level, and there's different things you can do. So surveillance activities can be related to core functions of public health. It can be part of policy development. It can be part of assurance as well. Okay, and it can be part of assessment. A quality surveillance system requires a collaboration of among different agencies and individuals. So this is called a Minnesota Public Health Interventions Wheel or an intervention wheel. Okay, so applications for public health practice suggest that surveillance is one of the interventions related to public health nursing practice. So surveillance is a pretty big part of what public health nurses do. Disease surveillance helps us establish the baseline. When there's an endemic, we want to know what the baseline rates of disease are and the patterns of the spread. And surveillance makes it possible to initiate a rapid response of an outbreak or disease with the right interventions. When you think about surveillance data, I always think about lab data in a patient. Let's talk a little bit more about surveillance and what our responsibilities are. And first, I want to talk about the National Notifiable Diseases list. Okay, so clinicians, healthcare organizations, and labs report cases to the State Department. Data also comes from the death certificates and administrative data such as discharge reports and billing records. All these pieces of information go into what's called the National Notifiable Disease Surveillance System, NNDSS. It is a nationwide collaborative that enables all public health people from the local to the state, territorial, the feds, international to share notifiable disease-related health information. So public health uses this information to monitor, to control, and to prevent any occurrence and the spread of any reportable diseases. There is two kinds of reportable illnesses I'm going to talk about, and there's national notifiable diseases, and every state also has state notifiable diseases. Some states do, and some states their notifiable illnesses mirror that of the national notifiable list. If you click on this link in your notes, you will be able to get to that list of national notifiable diseases. I urge you to look at it and study it. I will not test you on it, but it's very good for you to know what diseases and conditions need to be notified at a national level. Each of the data sources has potential for underreporting or incomplete reporting. However, if there is any consistency in the use of surveillance methods, the data collected will show trends in the events or disease patterns that may indicate a change needed in a program or prevention measure to reduce morbidity and mortality. State notifiable illnesses, reporting these disease data by healthcare providers to labs and public health care workers and health departments is essential to monitor accurately. And I have included Missouri's state notifiable disease list here. If you follow this link right here, diseases and conditions that are reportable in the state of Missouri are mandated by law and regulation. This is the 19 CSR 20-20 is the law that tells us what needs to be on the state notifiable list. It's very good for RNs to be aware of that list. Let's go ahead and discuss types of surveillance systems, and I'll highlight them in these notes right here. Remember that informatics are going to be essential to the mission of protecting the public health. Surveillance systems are designed to assist public health professionals in the early detection of disease, an event or outbreak, and to reduce the potential for morbidity and mortality, and we want to make sure that we're improving the public health status. So surveillance systems in use today are defined as passive, active, sentinel, or special. Those are the different types of surveillance systems. Okay? In a passive surveillance system, case reports are sent to the local health department by the healthcare provider or physician or a nurse, or a lab reports of disease occurrence are sent to the local health department. So that's a passive system. Case reports are summarized and forwarded to the state health department after they leave the local health department, and they're reported to the national government or organization responsible for monitoring that problem if it needs to go to the CDC or the World Health Organization. In a passive surveillance system, you just prepare a little report saying we have something going on here that probably needs to be noted. Okay? Flu cases and different things like that. Active system of surveillance, the nurses and the employee of the health department may begin a search for cases through contacts with the local health departments and agencies. So think about an outbreak of chlamydia. We're going to call people and say, we need you to come in because you've been in contact in a different way with this person, and we really need to come you and get tested. Actively looking for people. In this system, the nurse names the disease or the event and gathers the data about the existing cases to try to determine the magnitude of the problem on how widespread it is. An example would be when several school children become ill after eating lunch in a cafeteria or a local hot dog stand, in which case active surveillance would be used to investigate the possibility of food poisoning. So you're going to ask who ate here. Who was at that hot dog stand? How many people ate it? Now, let's talk a little bit about sentinel surveillance systems. Okay, in sentinel surveillance systems, provides the monitoring of key health events when information is not otherwise available or in a vulnerable population. You're looking at key things that you look for to calculate or estimate the disease morbidity. In the sentinel system, trends in commonly occurring diseases or key indicators are monitored, maybe using the Healthy People 2020. Those are things that probably qualify as sentinel surveillance systems. Special surveillance systems are developed for collecting a particular type of data. They may be a combination of different surveillance systems put together. Those are special systems. Example, as a result of bioterrorism, newer systems called, like you hear about, syndromic surveillance systems are being developed to monitor illnesses, but the biggest ones are passive surveillance systems, active surveillance systems. Public health nurses are most likely to have access to those two different types of surveillance systems. There are several concepts I want to talk about the investigation itself. Any unusual increase in a disease incidence, like new cases, or any unusual event in the community should be investigated by somebody. Usually, it's not going to be you as a bedside nurse, but a public health nurse may be assigned to do that. Patterns of occurrence can be identified when investigating a disease or event. These patterns are going to be used to define the boundaries of the problem, to help investigate possible causes or sources of the problem. Factors that must be considered as causes of the outbreak are categorized as agents. So you're going to hear things like the agent, the host, and environmental factors. The agent, the host, and the environment. Looking at those things. So what are host factors? Host factors may be the age, the sex, the race, the socioeconomic status, the genetics, and lifestyle choices. So the host factors are what's going on inside that individual. The cause of the illness is an agent factor. So the agent is actually the problem or the infection or whatever it is. The difference in temperature is an example of an environmental factors. So when you're looking at an investigation, you're going to look at what's the agent here, what's the host here, and what are the environmental factors that are adding to this. We'll expand more on this in a different lesson when we talk about evidence-based practice. This is components of what's called an epidemiological triangle. That's what we look at. But for now, just know that's the things that we'll look at. So an unusual increase in a disease or incidence should be investigated. I put it in red because it's very important. Let's talk about a few things that I want to make sure that you're aware of and understand. What does infectivity mean? Infectivity is the capacity of an agent to enter a susceptible host and produce an infection. So we're going to look at the infectivity of whatever the agent is. Okay, what is pathogenicity? Pathogenicity measures the proportion of infected people who develop the disease. Just because we have an agent doesn't mean that we're going to have high pathogenicity. Pathogenicity is how sick are people getting when they get infected. Some people get infected, but they do not get sick. Imagine this: if I was about to sneeze in a room of 14 people, not everybody that gets sneezed on is going to develop a cold. Pathogenicity is the proportion of infected people who develop the disease. What about how virulent a disease is? It is the proportion of people with clinical disease who become severely ill or die. Okay, we're looking at how many people, after they show the symptoms, become clinically ill or die. The objective of investigations is to control and prevent the disease or death by identifying factors that are going to contribute to it, and we want to prevent those occurrences. Okay, other terms I want to talk about. What is an endemic? An endemic, you should have heard this before in your previous studies, is a disease or an event found to be present in a population. Defined as endemic is persistent with a low to moderate number of cases. The endemic levels of a disease over an event population provided baseline of an example. Foodborne botulism is endemic to Alaska. Okay, hyperendemic is when if a problem is considered hyperendemic, there's usually persistently high number of cases. An example is high cholera incidence among Asians or Pacific Islanders. That's considered a hyperendemic problem. Sporadic problems is going to be one that has an irregular pattern. It's at irregular intervals. We can't really make sense heads or tails out of it. It's sporadic. Okay, an epidemic means that the occurrence of the disease within an area is clearly in excess of expected levels for a given time period. Okay, usually an epidemic is called an outbreak. You've heard that before. A pandemic refers to the epidemic spread of the problem using several countries or continents. An example of that was when we had the SARS outbreak that was considered uh, a pandemic. You're going to hear other terms as holoendemic. I define it here. Outbreak detection is identifying increase of frequency and looking at that. So those are some of the investigation terms I want you to be familiar with. Let's talk about patterns of occurrence. Patterns of occurrence are important. They can be identified when investigating a disease or event. The patterns are used to define the boundaries of a problem to help investigate possible causes or sources of the problem. An example, a common source outbreak. This means to a group means it refers to a group exposed to a common noxious influence such as the release of a noxious gas. Okay, ricin in the Japanese subway several years ago, that was a common source outbreak. A water system infection coming out in the US somewhere, common source outbreak. In a point source outbreak, all persons exposed become ill at the same time during one incubation period. So that's, you're going to hear the word point source outbreak. Okay? A mixed source is a common source followed by a secondary exposure related to person contact. So we had a common source go out, and then after that, then we have people giving it to other people. That's called a mixed outbreak. Okay, intermittent or continuous source cases may be exposed over a period of days, weeks. That's just going on and on. So you hear people say an intermittent outbreak. Example is food poisoning at a restaurant chain throughout the U.S. as a result of restaurant purchase of contaminated green onions. Remember that? That was an intermittent or continuous source outbreak. A propagated outbreak does not have a common source and spreads gradually from person to person over more than one incubation period. Remember that a point source is one incubation period. So propagated is, we just keep incubating. An example is the spread of TB from one person to another. That is a propagated outbreak. In summarizing our learning here, I want to mention that functions of surveillance investigation include detecting cases, estimating the impact of disease or injury, and showing national history of a health condition, determining its distribution, its spread of an illness, generating a hypothesis, and evaluating prevention, control measures, and facilitating planning. Although surveillance was initially devoted to monitoring and reducing the spread of infectious diseases, it is now used to monitor and reduce the chronic diseases and injuries, as well as environmental and occupational exposures. With tight budgeting, public health workers must know which programs should be developed and continue based on the most commonly occurring public health problems. This is a very important part of what a public health nursing does. Public health nurses do. Evaluation of the effectiveness of the programs requires a valid and reliable data, so this is a very big function of public health. Concepts, surveillance, and outbreak investigation. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.